Hello, everyone, and welcome. We're just giving folks a few minutes to trickle in, and then we'll get started.
All right, I think we can probably get started.
Yes, go ahead.
All right. So welcome, everyone. My name is Christine Riley. I'm a Director of Homeless Services here with the Chicago Department of Family and Support Services, and you have entered the Flexible Housing Pool Coordination Agency RFP webinar. So thank you so much for attending. As you all know, because you're attending this webinar, the release date was September 22nd, 2023, and the due date is October 19th, 2023 at 12 p.m. noon. So you will hear that throughout this presentation. Right now, I would like to introduce my colleagues and coworkers, and I will pass it along to Corey Berman.
Good afternoon, everyone, and thank you for joining today. I'm Corey Berman, a project coordinator for homeless services within the city's Department of Family and Support Services. In my role, I work with the program administrator for the Flexible Housing Pool, or the FHP. So the coordinating agency selected through this RFP will be very familiar with me soon if you aren't already. And I'll pass it to Alexa for her introduction.
Hi, all. Thanks, Corey. My name is Alexa Karchmar. I'm a Principal Operations Analyst here at DFSS, and I'm here to support this procurement effort. And I'll pass it to Shannon.
Good afternoon, everyone. I'm Shannon Ghetto, one of the project managers on the homeless services team. I do a lot of our results-based contracting and RFP development, so I've been working closely with our programs team on this, and we appreciate you being here today. I'll pass it back to, I think, Alexa.
It'll be Christine.
Christine, there you go.
So next slide, please. Before we get started, just a couple housekeeping rules. So everyone has been placed on mute. We didn't know how many people were going to be attending today, but just so you know, you've been placed on mute. We highly encourage you to please submit any questions via the question box, and we will respond to the questions in the middle of the presentation and then at the end of the presentation. So please feel free to put any and all questions in the question box. Also, if you are having any technical difficulties or issues, please let us know. If you can't hear us for some reason, if your text box isn't working, please let us know. And also, this webinar is being recorded for your information, and a copy of that recording will be posted on our DFSS YouTube channel with the link to the recording. So we will be sending out these slides and that recording link as well. Again, the slides will also be posted on our DFSS webpage, as you can see here. And you can find that under alerts and or funding opportunities. And that'll be hopefully posted within the next 5 business days. So again, thank you for attending, and I will pass it along to Corey.
Excellent. So today's session will give you an overview of the Flexible Housing Pool program, which we'll also refer to as the FHP. We'll cover the Flexible Housing Pool's program model, how it's evolved since its launch, and future goals for the program. We'll also make sure you know the selection criteria, attachments, deadlines, and helpful tips for applying. And then we'll have time at the end and in the middle when you can ask any remaining questions that you have. Next slide, please. Thank you. The FHP serves homeless individuals with complex needs, meaning chronic physical and/or behavioral health needs. Specifically, it targets those frequently cycling through emergency rooms, shelters, and incarceration. As a supportive housing program, the FHP, of course, aims to provide housing stability. What makes the FHP model distinct is it also aims to eliminate unnecessary crisis system encounters as a major program objective. This means reducing days spent in jail, less shelter visits, and replacing default visits to the ER instead with health services that are appropriately matched to the health condition and severity. The FHP model employs several approaches to accomplish this. It centralizes the housing coordination process, from securing hundreds of housing units to supporting clients' ongoing success while living in them. It provides funding flexibility to address issues that may fall beyond the constraints of how designated funding can be spent, and it aims to create a streamlined collaboration pathway so that public and private funders can work together as efficiently as possible. Through the request for proposals, DFSS will select an organization as the Flexible Housing Pools Program Administrator for the next 3 years, starting January 1st, 2024, with an option to extend the term for an additional 2 years. The program administrator will facilitate collaborations across sectors that support people with complex care needs experiencing homelessness, with the program administrator performing roles that center housing access and sustainability. It's important to note that the FHP was designed as a new housing model that can target gaps in supportive housing, and the program continues to evolve based on emerging needs. Because of this, developing and sustaining systemic collaborations will be critical for the FHP to continuously address the most current and pressing need areas. Next slide, please. Thank you. Existing models throughout the country help to inform the flexible housing pool's design. Overall findings from research on the topic show how supportive housing programs reduce long-term spending on emergency services. They improve outcomes for chronically homeless persons. Some examples of this: Los Angeles's Housing for Health program decreased hospital visits by more than half. And a study of Denver's supportive housing social impact bond initiative captured additional positive outcomes like preventative care participation increases, as well as reductions in police interactions. The FHP was also created in response to some Chicago-specific needs assessments, including data showing a nearly 300,000 unit deficit in housing for Chicagoans who have extremely low incomes. In January 2018, a request for information was released to inform FHP strategic planning. The program then launched April of the following year. The FHP started with just an adult cohort. Homeless adults with high emergency service utilization are identified for the program using a combination of HMIS data matching and health system identification processes. The FHP now also includes a youth cohort, youth ages 18 to 24, who mainly enter the FHP through the DFSS Service Coordination and Navigation Program, or SCAN for short, which focuses on youth at high risk of violence involvement. And then there's a third emerging reentry cohort, which is in partnership with the Illinois Department of Corrections. So far, over 1,000 households have been housed through the FHP, with over 90% remaining housed. And as far as governance structure, all investors in the FHP are invited to serve on a governance council with equal votes. A primary feature of the funding structure is the FHP escrow account. And then a more recent development funding-wise is a new $6.6 million investment that will serve the youth cohort over the next few years. Looking forward to the future of the program, priorities include expanding the program's funding models, especially Medicaid funding, reducing the length of time for homeless adults to enter housing, and further integrating best practices. And you can find descriptions of the best practices that are listed here in Appendix A of the RFP. As mentioned, the FHP serves 3 cohorts. There's homeless high-need adults who frequently access crisis systems. There's housing insecure youth ages 18 to 24 who are at high risk for violence involvement. And then there's the newly forming re-entry cohort following incarceration with the IDOC. We'll now transition to look more closely at the requirements for the FHP. The primary responsibilities of the FHP Coordination Agency are program administration and oversight. This includes operating the FHP and refining its regulations with collaboration from government's council agencies, and as well under the direction of DFSS. Housing portfolio management, this will include securing a range of decent, safe, and affordable housing throughout Chicago for individuals who are homeless, engaging landlords, entering a range of leasing agreements like master leasing and scattered site leasing, streamlining the housing application process, overseeing rent payments, ensuring 24/7 crisis availability for landlord issues, and importantly, establishing housing quality standards and inspecting to ensure that they're being upheld. Regarding fund management, the FHP Coordination Agency needs to provide dependable monthly subsidies to a growing number of property owners, administer the Client Assistance Fund, which addresses tenant needs like transportation and food, and maintain best practices for financial controls. As part of the program requirements, the coordination agency will also provide pre-tenancy and tenancy supports, or HTS. This is a whatever it takes model of wraparound services to keep clients housed. And you can see Appendix C of the RFP for a more detailed overview of these activities. HTS can be provided by the coordinating agency itself or through a Cook County health provider under their direction. The HTS does client outreach and FHP engagement, also collaborating with partner organizations to locate clients. And lastly, relationship management. The coordination agency will dedicate a full-time FHP project manager as a point of contact for DFSS, landlords, and project partners. The agency will need to grow its staffing capacity in alignment with the program expansion and demand. It will engage a range of project partners to include landlords, public agencies, and funders. It will also manage tenant-client relationships and community issues with FHP operations. Expectations include conducting data collection, fiscal management, reporting, and program improvement with input from the Governance Council and DFSS. And then there is also potential to develop and operate an information technology system that interfaces with HMIS. The FHP's performance measures will continue to be tracked through a governance dashboard. Applicants are strongly encouraged to suggest additional metrics as well. The dashboard metrics include enrollment and housing, retention data, length of time before being housed, and demographic-based data, which helps to assess the program's equity. For selection criteria, you will be asked about the target population your agency will serve and whether it serves high-need communities, how your agency receives and incorporates feedback, what specialized activities your agency will pursue to offer highest quality services, and diversity in your leadership. In terms of organizational capacity, your organization will especially need to demonstrate use of best practice financial controls. The city will make payments on a reimbursement basis, so applicants are asked to outline strategies that they will use to pay the costs up to 2 months at a time prior to being reimbursed. And then the strength of your program will be assessed based on how many clients you plan to serve, client outreach and retention methods, how well your program activities align with the goals of this RFP, and evidence-based practices, which again, you can find in Appendix A. For performance outcomes, we will pay special attention to preventing disparities in client outcomes, how you will use the data you collect to strengthen your program, and ability to retain and grow personnel capacity so that it aligns with the growth of the program and its emerging needs. Please make sure that you don't forget to attach a 1-year proposed budget based on the FHP budget assumptions, which is on page 36 of the RFP, which are also listed on this slide. Note that DFSS will establish rent reasonableness criteria in the program rules. Also note that additional funding will be available in the FHP for participant special needs, as well as funds for deposits and furniture. So these costs should not be included in your budget. And then These criteria align with several topics we've already covered, like best practice financial controls, securing additional funding and Medicaid reimbursement, and budget assumptions justifying the reasonableness of your proposed program costs. Please make sure you include all 10 attachments listed here, plus your organization's proposed budget, which means 11 documents total. And I'll pass it to Christine now, who will describe the specific requirements for your proposed budget.
Thank you, Corey. Next slide, please. So with your budget, as stated, please, it should reflect a 1 year, 12 months of services. So again, the budget period would be from January 1st, 2024 through December 31st, 2024. We are looking for cost category definitions. They are attached to the budget instructions. Please make sure you refer to Appendix E or page 36 for the budget parameters as well. Be thoughtful and inclusive when developing your budget. We highly stress that you apply for your program's actual proposed cost. As you see, we cannot give you more than what you ask for. But just know that we can give you less, but we are stressing that you apply for your program's actual costs. And use reasonable cost questions in the application to justify how the budgeted costs are reasonable based on the services and program requirements. And again, I'm going to stress, please apply for your program's actual proposed costs. Next slide, please. Just some common errors that we have experienced and seen on past RFP applications. Make sure your fringe calculations are correct on your budget. In regards to supplies, they are frequently under or over budgeted for. Make sure your job description titles and your job description uploads have the same title. Also put a brief description on the job in the budget document itself if you have not discussed it specifically in your application, and then put your budget in the appropriate column. Again, these are some frequent common errors that we have seen on past budgets when submitted. So we want to make sure that your budget is perfect when you press that button. And I think that's it for me, and I'm going to pass it back over to Corey.
Thanks, Christine. So this slide contains all of the important dates for submitting your FHP RFP applications. You can check off the pre-proposal webinar, which we're in currently. The next date of note will be Wednesday, October 11th at 12 p.m., which is the deadline for any questions about the RFP. The application itself is due in 2 weeks on Thursday, October 19th at 12 p.m. Please don't wait until the last minute to submit. Give yourself enough time in case there are any unexpected delays. And finally, the program period will begin on January 1st, 2024. Again, this is a 3-year contract with the option to extend 2 more years. Agencies can apply individually or as multi-agency partnerships, but one agency still needs to be listed as the lead. And just to drive this date home, Thursday, October 19th at noon is the deadline to submit your FHP RFP application. And before we pass it on to Alexa for some final application tips, I think we're taking a moment to answer any questions.
Yes. So I haven't seen any questions come into the chat. So why don't we give folks a moment, and if you have a question, please enter it now using the Q&A box at the bottom of your screen. Okay, we do have our first question. So either Christine or Corey, whoever is most comfortable answering, from where are the budget assumptions coming from?
I'm sorry, where, can you go back to that slide, Alexa, with when we mentioned the budget assumptions? Thank you.
Yes. Is this? the slide you're speaking of, or?
Yeah, I'm trying to see. I think okay, yeah. So I guess clarity on the question, so it's referred here in regards to page 36, but budget assumptions is based on, and we'll get clarification on this, and we will answer through an amendment, current program costs, etc. But we will get that question. Shannon, do you have a?
Yeah, so I can add a little bit more to this
Thank
because
you.
I was the one who kind of led for this portion, and we're happy to follow up an amendment if there's any additional information that folks are seeking or clarification. But essentially, we used program financial data to kind of understand and create the assumptions for what it will likely cost the program administrator to operate this program based off of the different assumptions. So this is something that we had kind of worked on to provide an Appendix E. And if there's any other information or questions that you have, you can let us know. But the assumptions are there, and it's kind of based off of what kind of the common cost of renting in a one-bedroom apartment is in Chicago through the current kind of program parameters of the FHP.
Thank you, Shannon.
Yes, thank you, Shannon. That is the only question I'm seeing at the moment. So please do continue to submit questions, and we'll pause again at the end of the webinar if necessary. Oh, I see one more question following up with the previous. Do we need to stay within this parameter? Could you specify what parameter you're referencing? The budget assumption.
Shannon, will you be able to respond to that, or we can put it in the amendment?
So if you look at this slide, you can kind of see that some of the items for the budget parameters are going to be set by DFSS, and those are things that we will determine. So you don't need to worry about like falling within that necessarily. It's supposed to give us some guidance in terms of how much your potential program costs may be in your first year of operation as the program administrator. We can provide additional information in the amendment because I realize now that we did say that your proposed budget should reflect your true cost. And we're also saying that you should be following these parameters. And so we can clarify that point if that was kind of more what you were pointing to with your questions regarding the parameters and that kind of guidance that we provided in the webinar. So we'll get back to you about that point.
Thank you, Shannon. Okay, continue to submit your questions, and I'm going to go ahead and move forward for now. All right. Okay, so I'm just going to walk you through some technical tips for submitting your application through e-procurement, and you'll have contact information in these slides and at the end of these slides if you have any further questions about using the procurement portal itself. But our number one tip is start early and save often. So it does take a while once you create an application within eProcurement, or I'm sorry, once you create an account within eProcurement, it takes a while for that account to be verified and confirmed. And so we recommend that you do that well ahead of time, and that you save your draft every time you go in to make an edit, because otherwise you might lose some of the changes that you make to your application. Once you do open it, you do have the option to save it as is and then return to it later to finish. You can submit your application and later amend it up until the due date. So that's Thursday, October 19th at 12 p.m. CT. What that means is you can submit the application, and then should you want to make a change before that due date, you'll be able to go into the portal and make a change. We recommend avoiding the rush by submitting early and planning on about 30 to 60 minutes just to enter whatever data into the application online and have it submit. Please do make use of our e-procurement hotline. If you need any further assistance with using the portal, that's 312-744-4357, or you can email customersupport@cityofchicago.org. Both of those operate during normal business hours, Monday through Friday, 9 to 5, but of course, send us an email after hours and we'll get back to you when we can. And please note that late applications will not be accepted, so that October 19th at 12 p.m. is a hard deadline. Save often, submit early. For technical assistance beyond what I'm providing today, here are some tips again. So there's the contact information for e-procurement technical assistance that you can reach during business hours. There's also information on the DFSS webpage. So if you click the alerts section on our website, you should see any outstanding RFPs that are open for applications and any related updates, as well as some training documents. There also are training materials available in this at this link within the city website, and you will have access to these PowerPoint slides should you want to just click the direct link. Now, they mentioned earlier, Christine and Corey and Shannon, that you will be receiving thorough answers to your questions in the form of an amendment. So we will be posting an amendment to the original RFP, and you will have to accept and acknowledge that amendment to be able to submit your application, because we want to make sure that everyone has the same information when they apply. So now I'm going to walk you through how to accept an amendment after it is posted, and that way your submission will go through. So if the RFP you're interested in has been amended, then you will see this warning on the left-hand side here, circled in red, that the RFP has been amended and that you have to view the history and accept the amendment to be able to apply. If you don't see this warning, that means there's no pending amendment. You can just go ahead and create your application. Excuse me. By clicking create quote in this drop-down list on the right, and then clicking go. Should you begin an application and an amendment later is posted later on, we'll touch on that in just a moment here. So go ahead and create your document. And then once you're beginning the amendment acknowledgement process, you'll click on that amendment history link in the warning box we were looking at, and you will see a list of any active amendments. So the document number here on the left will tell you whether it's amendment 1, 2, or 3, etc. And then on the right here, this little eyeglass symbol will allow you to review any changes made to the RFP based on the amendment. So you can click there to see the text of the amendment itself. And then here, number 3, you'll see acknowledge amendments. So at this point, after you have reviewed the amendment and you feel ready to accept it, you can go ahead and click acknowledge amendment. There are several follow-up screens because we want to ensure that folks do indeed read the information carefully. So follow with me along this process. So after you click acknowledge amendment, you'll see this screen where you can accept the terms and conditions that are included in the amendment itself. So you click that checkbox and you click acknowledge. And then this confirmation page will appear. And you will have to go ahead and click yes on the right-hand side to confirm that you do in fact want to respond to the amendment. And then finally here, you will see a terms and conditions page that you'll have to go ahead and accept. And you can accept that by clicking the checkbox in the bottom left-hand side, and then clicking accept in the top right or in the bottom right. For submitting your application, So when you're ready to submit, once you've completed the entire application, go ahead and click Save Draft one last time, and then click Continue here on the right. If you're missing any information in your application, when you click that Continue button, you'll see an error message, and the error message should point you to the exact issue with the application. So I'll show you an example of that. Here, the error message says that the control requires you to quote on all lines. Quote is just entering text. And so we'll go here into lines, and we'll make sure that we filled out that section completely to make sure our application is complete. Here's a second example. The quote value is required for requirement first name. So we go to the requirements section, item titled first name, and we'll have to enter something in this text box here. So it will not allow you to submit an incomplete application. It will let you know if there are things missing. Once your application is free from errors and you press that continue button, you will see the option to review and submit. So click, excuse me. So once you're in this space, you can click submit, and it will show you this printout basically of all of the data that you've entered into the application itself. And so you'll have a chance to review everything, make sure it's accurate one last time. And then once you've reviewed it, at the bottom of the screen, you're going to go ahead and see that you can create an electronic signature by clicking the checkbox and filling out your name and title. And then you'll click submit in the bottom right. Make sure you see this confirmation message pop up on your screen before you exit. If you exit prior to seeing this, then your submission might not go through. And then just some final contact information. So for any program questions, you can contact Christine at 312-746-8727 or at christine.riley@cityofchicago.org. For non-programmatic questions, contact the e-procurement hotline. That's 312-744-4357 or customer support at cityofchicago.org. And before we leave for the day, I did see a couple of additional questions come in. If Christine or Corey would like to address them. The first question is, will there be any in-person presentations that need to take place?
So I can respond to this question. So in section C of the RFP narrative, under basis of award on page 13 of the RFP, we state that DFSS reserves the right to seek clarification of information from those who submit applications. And that can include, site visits if applicable, or they may have to do oral presentations or be interviewed by the review committee if necessary. So we do have that option as we start to review the applications, and we'll notify respondents as needed.
Thank you, Shannon. And then a final question, is there no budget for this program?
So
Okay.
go ahead.
All right, sure, I can take this one.
Okay.
So section 1, page 11 of the RFP will give you more information. The current available funding for the FHP is about 19.3 million, but funding may increase each year, reaching up to 40 million in a single year. Currently, there's about 7.07 million available through the City of Chicago, and remaining funds of about 12.3 million available through non-city funds. And then we mentioned the 6.6 million additional for the youth cohort.
Thank you, Corey. And those are all the questions we've gotten for now. So please do contact us if anything else comes up. But for now, I will let you all go, and I thank you for your time.
Thank you, everyone.
Thank you all.